Hello and welcome to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about pneumonia, but more specifically, pneumonia in adults. Pneumonia is a term that's loosely thrown around. So is it a chest infection? Is it pneumonia? But overall, it's a common condition with an annual incidence of about 8 cases for every 1,000 in the adult population. It increases with age. It peaks in wintertime. There is a mortality for those managed in the community at about less than 1%, but 25% get admitted to the hospital, and the mortality there rises to about 9%. So we're going to be talking about the presentation, common causes of pneumonia, prevention, differential diagnosis, investigations, management, and some complications as well. So let's get into the video. Okay, so the most important thing is differentiating between, is it just a common cold or is it pneumonia? So the presentation is absolutely the most important thing here. So what is pneumonia? How does it present? So it is an acute illness characterized by symptoms of an acute LRTI. So symptoms of an acute lower respiratory tract illness. So that's cough plus one or more other lower respiratory tract symptoms. So what I mean by there is something like purulent sputum. So, you're producing that yellow-green sputum, or pleurisy, for example. Then a new focal chest sign on examination. So when the doctor listens to your chest, is there decreased air entry or is there coarse crackles going on there? Plus one or more other systemic features. So temperature above 38, sweating, fevers, shivers, aches, pains, and as well, no other explanation for illness. So that is what pneumonia presents with. So it's an acute illness characterized by the following. The one caveat to remember here is that there is the elderly population, and they may present a little bit atypically. So, for example, they can be a bit confused or they can be off their legs that you can hear commonly. But generally, in adults, pneumonia, this is how it presents. So this is the main way how you can say, okay, it might just be a simple cold, you have a bit of a runny nose, or it might look like pneumonia. Now we move on to common causes of pneumonia. So what are the common causative organisms of pneumonia? So there can be plenty, but there are a few common culprits. So pneumococcus, streptococcus pneumonia accounts for about 36% of pneumonia infections. Another causative organism is H. influenzae. So that's about 10% there. So that's more commonly amongst the elderly. Then we have influenza type A and B, which is the annual epidemics during the winter months that you hear of. That's about 3%. And then we have mycoplasma pneumonia. So that's about 1.3%. That's less common in the elderly, and epidemics of that occur every 4 years in the UK roughly. We have gram-negative enteric bacteria, 1.3%. We have a chlamydia bacteria, which is about 1.3% as well. And 20% of those have history of bird contact because of the way that is transmitted. Staphylococcus aureus, 0.8, so more common in the winter months and may be associated with other viral infections like the flu. So you can have the flu and then get this. You have Legionella, so that's most common in September and October, and a vast majority of them are related to travel. So we have bacteria that cause pneumonia, so which is this whole list, and then we have viruses that cause pneumonia, which is what I mentioned. At about 3%, we have influenza A and B. Now, thanks to modern medicine, we have developed vaccines for some of the most common causes. So influenza viral vaccines we have, and pneumococcal vaccinations we have. So for the biggest bacteria and the biggest virus that cause pneumonia, we have developed vaccinations for these. And more importantly, there's another vaccine that we've all heard of, which is the COVID vaccine, which serves to tackle COVID-19, which is a virus that can eventually, potentially, cause pneumonia as well. And these causative organisms are important because if we are ever investigating this and we get the results of this, it can sometimes guide us in certain directions. So if, for example, Legionella has come back on the result, then we can say, okay, this individual maybe picked this up somewhere related to travel. So there are certain, or maybe he is immunocompromised if there's another bug, for example, that's a bit more rare and not as commonly detected. So these are the things that can help us out. All right, so let's talk about now the differential diagnosis. So we have our presentation. We think it's pneumonia. What else could it be, actually? So there are certain things that it can mimic pneumonia, hence the word differential diagnosis. So it all depends on the history. So the history will guide us the most, because if it sounds like pneumonia, fine. But sometimes there can be other things that you can pick up on, such as, are there any red flags? So has the patient been losing weight? How long has this been going on for? Is there a history of smoking, for example? Are they immunocompromised? So a differential diagnosis in general, if it's an acute presentation and we think it's pneumonia, we always have to think about these ones. So pneumonitis. So is it secondary to radiotherapy or some sort of inhalation? Is it pulmonary edema, which can present in a similar way? And also, is it a pulmonary embolism, which is arguably the most urgent out of all of these, and it can make you feel quite unwell. So how are we going to actually look into this a little bit more if the symptoms are lingering on and we're thinking, okay, is it pneumonia? Maybe is it something else? We have to investigate. So what are the investigations for pneumonia? Let's talk about that now. So when it comes to the investigations, there are things that your GP can do, and then there are things that your GP can't do. So meaning these are the things that you will do in the hospital. So I'm going to be speaking both of these things, but more so focused on what you will see, what the GP does. So when you come and see the GP themselves, what are they actually going to do for you? So there are certain things that you can do as a plan A and certain things that you can do as a plan B. Again, it all depends. So initially, a lot of this can be investigated through just doing a proper history and through the presentation. But if we're looking at investigating it, then we have things like an ECG. So this is generally going to be happening in the hospital, not necessarily in general practice or with your family medicine doctor. It might happen a little bit later, but generally speaking, it will happen elsewhere. The same thing goes for a blood test and also a chest x-ray. So these are the three things that they can happen in general practice. They can do them when you go visit your GP, but it will probably take a couple days or a week. And when you're having an acute presentation, this might not be good enough. Then we have other things that your GP can do. So they can check your pulse oximetry. So they can put the probe on your finger and see what the saturation of oxygen is in your blood, as well as your heart rate. They can check your blood pressure, and they can check whether you have a temperature. The sputum culture is another thing that it does take a couple days, but that is something that we might do if we have the time to do it. It all depends on the severity of the acute presentation and whether we need to do something about it or not imminently. That brings us on to the assessment of severity. So how do we actually assess how severe this presentation is? So we went through the presentation, but now it's how do we actually assess the severity? We use the CRB-65 score. So C stands for confusion, R stands for the respiratory rate, above 30 breaths per minute, B stands for blood pressure, and 65 stands for age 65, the age of 65. You get a point for each. If it's 0, you're likely suitable for home treatment, which is good news. If it's 1 or 2, you consider hospital referral, which is not so good news. And if it's 3 or 4 points, you have to do an urgent hospital admission, which is definitely not good news. So this is how you actually assess the severity of what is going on. In addition to that, first acute illness presentation. So what we mentioned at the beginning of the video. And then that brings us to our management plan. So how are we going to manage pneumonia in adults? So we can assess the severity, and we can determine based on the history and examination, put all of that together and decide, okay, we can consider a hospital or not. So consider the need for admission or not. If we are not considering admission and if we are deciding to treat at home, then there are certain things we have to do. So certain lifestyle things we advise the patient. Try not to smoke. It's self-explanatory. Rest, drink plenty of fluids. That's also pretty self-explanatory. Treat the pain. So if you're coughing and you're getting that ache in the chest, you treat the pain with simple analgesia like paracetamol. And then you treat the infection. Treat the pneumonia with antibiotics. Amoxicillin generally, if you're allergic to that, then you can have doxycycline, things like that. Then you review the situation. If it's not getting better, and if we're still not on that need to consider the need for admission, then we consider investigations. So the sputum, the x-ray, the blood test, the things we mentioned earlier on. And as opposed to that, we have to consider the hospital if we need it. So this is generally the management of pneumonia. And that's basically it. That's all we do for pneumonia. It sounds pretty easy, but there are a few things and weighing up of risks and benefits, what we have to do, weigh up the pros and cons. How severe are we? How unwell are we? We always have to take in consideration the patient as a whole. So are there other things going on that we need to consider? Are they immunocompromised? Do they have other illnesses going on like cancer or kidney failure? Things like that. We put it all into one picture. We categorize it. We weigh up the pros and cons, and then we decide to treat in one way or another. So that was pneumonia in adults. Thanks for watching the video. Like and subscribe, leave a comment in the section below, and we will see you in the next one.